Malacanang says vaccines from Astrazeneca will finally arrive tomorrow. But health experts are worried about the Oxford's jab's reduced efficacy against the more infectious South African variant based on a previous study. The health department confirmed one more case of the South African variant in Pasay, bringing the city's total number to 4. The UP-OCTA research team is keeping a sharp eye on the increased COVID-19 infection rate across Metro Manila. And in lighter news, artists in Germany showcase the life inside the bubble in a pandemic-themed photo shoot. Fast, focused, and fearless. Here's a roundup of stories we're watching now. I'm Riza Diaz. The Philippines is set to receive more COVID-19 vaccines on Thursday, this time from Astrazeneca through the COVAX facility. Greg Gregorio is joining us live from Mandaluyong to discuss that with us. Greg, how many doses are we expecting tomorrow?
Riza, Malacanang confirmed that the arrival of the first shipment of vaccines from the British-Swedish manufacturer Astrazeneca through the COVAX facility has been scheduled tomorrow. Spokesman Harry Roque said the government is expecting at least 487,200 doses, but vaccine czar Carlito Galvez Jr. refused to confirm this, noting that the arrival has been delayed twice. The country was initially scheduled to receive a shipment from COVAX by mid-February and eventually moved to March 1, but this did not push through due to logistical concerns. And on Sunday, some 600,000 doses have been donated from China. Sinovac arrived in the Philippines. Meanwhile, one member of the UP-OCTA research team is worried that the pre-ordered vaccines from Astrazeneca might be useless if we fail to contain the spread of the South African variant in the country. Citing a study in South Africa, Father Nicanor Austriacus said the British-Swedish company's jab only offers an efficacy rate of as low as 10% against the new variant. South Africa was supposed to use AstraZeneca jabs for its inoculation program, but had to replace it with Johnson & Johnson's vaccine. The health department also admitted before that a mutation included in the B.1.351 variant affects the antibody generation of an individual. Meanwhile, Austriacus said Sinovac's Coronavac would even be more effective against variants in the long run compared to AstraZeneca's shot. Dr. Edsel Salvana of the DOH Technical Advisory Group also shared this view. He said Coronavac may potentially be resistant to other variants. Let's listen to the experts.
Itong Sinovac po is a full inactivated vaccine. Ibig sabihin yung buong virus po, hindi lang pyesa. So yung katawan natin gumagawa ng different kinds of antibodies against the whole virus. Kaya mukhang potentially mas resistant po talaga ito sa ating variants, and there is preliminary data to support this.
In terms of the long-term goal, you might want to pick Sinovac over AstraZeneca because even though the efficacy for Sinovac is a little bit lower than AstraZeneca, it will protect you against the B.1.351 while AstraZeneca will not.
Riza, 23 adverse events have been recorded since the government started rolling out Sinovac's Coronavac. That is according to the Food and Drug Administration. None of them, though, are severe. The FDA Director General Eric Domingo hopes that the inoculation of key health officials will help boost vaccine confidence. Riza?
Thank you for that report. That was Greg Gregorio reporting live from Mandaluyong. The UP-OCTA research team raises the alarm anew over the spike in infections in some parts of Metro Manila. Professor Ranjit Rai said the COVID-19 reproduction rate in the capital is now ranging from 1.3 to 1.5. The figure remains above the ideal threshold of 1. Rai warned that daily cases in NCR could reach up to 2,000 from the current 770 if the trend continues until the end of March. The research team is calling on the government and public to ramp up measures and observance to health protocols.
What we do suggest is that we all take this rise in cases all around the NCR seriously. We need to adjust our behavior. Government needs to adjust its strategy and intensify testing, tracing, isolation. It needs to intensify or it needs to accelerate.
The health department confirmed another case of the more infectious South African variant in Pasay, bringing the city's total to 4. With this, an infectious disease expert is calling on the public to be more cautious. In an interview with us here on One News, Dr. Ronchin Solante of the San Lazaro Hospital said the variant may be causing the spike in infections in Pasay City. Solante noted, however, that more data are needed to confirm this.
The fact that this is a localized surge of cases in Pasay only, and those 3 cases were also documented in that particular area, the more that we need to be careful now.
Meanwhile, the Interior Department is not ruling out the possibility of placing the entire Pasay City under ECQ or MECQ. But Undersecretary Epimaco Densing told sa totoo lang that granular lockdown is advised to remain as long as they see that it's helpful in mitigating the COVID-19 spread.
Kung may ila-lockdown, granular po ito per barangay, per street, per building. At siguro last resort na po ang pagdedeklara ng isang MECQ or ECQ sa isang lokal na gobyerno.
The Health Department logged more than 1,700 new COVID-19 cases today. This brings the country's total caseload to 582,000, around 35,000 of which are still active. 20 more people died of the virus overnight, pushing the death toll to more than 12,300. Total recoveries now stand at 534,700, with 330 new survivors in the past 24 hours. Thousands of health workers at the St. Luke's Medical Center, Quezon City, said that they are willing to receive a Sinovac vaccine. But it's a different story at a private hospital in Pasig, where only 4 health workers volunteered to get the shot. Jenny Dongon is joining us over the phone for details. Jenny, what's the latest?
Risa, around 1,600 healthcare workers signed up to be vaccinated in St. Luke's, Quezon City as the hospital rolls out its vaccination program today. The hospital management said they're aiming to vaccinate 200 health workers daily. Among those inoculated is St. Luke's Chief Medical Officer, Dr. Benjamin Campomanes, in order to boost vaccine confidence. Campomanes assured its staff that they have enough funds to procure vaccines for 9,000 employees. Over in Pasig, the medical city received 4,000 Sinovac doses this morning as part of the government's vaccine rollout. However, only 4 health workers were willing to take the job. Despite this, TMC President and CEO Eugenio Ramos is confident that they can encourage more employees to receive the vaccines. Health Secretary Francisco Duque III personally administered the first shot in the hospital. He then urged health workers to take the opportunity to be vaccinated now. Overall, 3.4 million vaccine doses are needed to cover all 1.7 million health workers across the country. Risa, the health secretary, assured the public that they will also investigate reports that some politicians have been vaccinated despite their non-inclusion in the priority list. Risa.
Thank you, Jenny Dongan. Meanwhile, the World Health Organization takes us to the so-called journey of a COVID-19 vaccine from development and critical trials to inoculation. Let's watch this.
The journey of a vaccine. After proceeding through the 3 clinical testing phases and extensive quality control measures, an approved vaccine will begin production. WHO works with national regulatory authorities to continuously assess the quality and safety of each potential vaccine throughout its development. Countries or companies will typically work independently to complete trials and testing of a vaccine. Once a vaccine is authorized, scaled-up manufacturing begins. WHO assesses each vaccine in development and may grant an emergency use listing designation for use outside of clinical trials. The antigen is developed and combined with other ingredients. Quality and safety checks are undergone throughout production, and completed vaccines are stored in glass vials. Batches are carefully checked for quality before leaving the factory and are stored at cold temperatures between 2 and 8 degrees Celsius, minus 20 degrees Celsius, or minus 70 degrees Celsius to maintain integrity. Vaccine stock is flown to destination countries in refrigerated storage, then driven on refrigerated trucks, taken to a warehouse cold room, placed in smaller portable ice boxes, then transported to local areas, and administered by local trained health workers.
Now for some light news, ballet dancers in Germany showcase the so-called life inside the bubble in a pandemic-themed photo shoot. This is part of German artist Florian Minnert's latest work to portray social distancing and isolation during the pandemic. Musicians and actors were also asked to pose for the project. Each of them were only allowed to spend 10 to 15 minutes inside the airtight bubble. Now, for more updates, visit News 5, The Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. We are One News.